Hi, my name is Dave Hoy. I'm back from Phoenix Rehabilitation. Last time we did a video with Julie, we talked about centralization and how different positions or activities can centralize someone's pain. For example, pain coming from the foot and centralizing back to the low back. So the second concept that we always work on with our low back patients is spinal stability. So we're going to go over the three basic stabilization activities that we start with our patients today. And again, Julie's going to demonstrate as we go. The first one we're going to work on works the transverse rectus abdominis, which is simply a diagonally oriented abdominal muscle that helps control the spine from the front and the back. So I'm going to ask Julie to lie down on her back. She's going to have her knees bent up. We always kind of cue the patient right in here because this is the area where that muscle works. So I ask the patient to put their hands on top of my thumbs, and she's going to make that muscle tight. She's going to count to 5, and then she's going to relax. It's very important that when she's contracting that muscle that she's feeling that stability on both sides of the spine, and it's also important that she breathes because that's how we need to function. So generally with a patient, we'll do a 5-second hold. We'll do about 10 repetitions at a time. Okay? The second one we're going to do is the gluteus medius, or a clamshell activity. So Julie's going to roll on her side. She's going to face that way, and she's going to cue that muscle off the top of her hip. So what she's going to do is she's going to make that muscle tight. She's going to keep her feet together, and she's going to pick her knees straight up this way. Okay? And she's going to go up and down about 30 times. It's important that her hips stay in a line. It's important that her feet stay together. Okay, now Julie would repeat that on the other side if she was to do that at home. And the third of the basic elementary stabilization exercises would be glute sets. And to do that, she's going to lie prone or lie on her stomach. So what she's going to do is she's going to reach back. She's going to make sure she's getting her glute muscles tight, but not her hamstring. We don't want the hamstrings to be dominant. We want the hip stabilizers to be dominant. So she's going to squeeze, make those tight. She's going to count to 5, and she's going to relax. And just like the transverse rectus abdominis, she'll do 10 of these repetitions per set. Okay, so those are the three basic stabilization exercises that we'd start with a low back patient. If you should have questions about this or think that therapy in this manner will benefit you, please contact us. Thank you.